So I've been binge listening to the podcast that you do with your wife there. And I will say that you inspired me to take a second look at my oral health. I did order some disclosing tablets to have a little family challenge to see who brushes the best. So we're going to do that once that comes out. Ordered it on Amazon or whatever. So
you just made my day.
Yeah.
Thank you.
Good. I appreciate your show. I like, I don't know, like most people, I probably need some reminders with oral health, like with many things, but no, it's a lot of good information, and I'm glad she reached out to me and I could consume that content at least. So
beautiful. So in fact, I was reading an article today. You know, the number one reason why people don't see a dentist?
They're afraid of.
That's number two.
Okay.
That's number two. And cost is number three. Number one is lack of pain.
Oh, they just don't know.
I feel fine. Why would I want to see a dentist?
Yeah.
And high blood pressure, diabetes, glaucoma, cancer, same thing. There's no pain. So just because there's no pain doesn't mean it's okay, but yet that's the number one reason why people don't see the dentist.
And you know, I told your wife that was your wife, correct?
No, that's Suzanne. She's Jim's wife.
Okay. Gotcha. You're at their house?
Yeah,
okay.
At their house. Yeah.
Okay.
Yeah.
When I reached out to her, I told her I had just watched Root Cause on Netflix. Have you seen that? It's a documentary about root canals and basically when they get infected, and it can really affect the health of a lot of people. And a lot of the message that I've heard coming from your podcast is very similar, that we don't think to check the health, the oral health, as affecting so many other parts of the body. And people try and, treat it with drugs, with, whatever type of a solution, but they don't even think, hey, maybe it's bacteria, maybe something is coming from a bad root canal. And that's, systemic
Today
problems.
I was reading an article that they're already linking Alzheimer's to oral bacteria. And there's one particular oral bacteria, and I wish I could remember the name of it. But anyway, it is responsible for helping to create the beta amyloid, which is one of the big things in Alzheimer's.
Oh, wow.
So it's like, the toe bone's connected to the foot bone. The foot bone's connected to the ankle bone. We are so interconnected. And yet, when you look at most physicians, you take care of the heart, you take care of the lungs, you take care of the GI system, you take care of the whatever it is.
Mm-hmm.
And maybe we'll talk or maybe we won't. But somewhere there's just got to be better communication. Somebody's got to be the quarterback. And it used to be the primary care.
Yeah. Well, and I've heard that you've been making some strides bridging that gap between like the medical doctor community and the dental doctor community. I think there's a lot of, even within medicine, there are silos of the specialist, right?
Oh, absolutely.
Bring in, dentists, oral surgeons, and all that category. Plus, then you've got, depends how far you want to go, but you've got, chiropractic world, and you've got homeopathic, and all these other things that all can work together, but oftentimes we don't. They don't talk together.
Well, everybody wants to be right.
Yeah.
And, somewhere I think everybody's a little right.
Yeah. Yeah. I think, to the extent that people like you are getting this message out there and reaching out to other professions, to include the medical world, I think that's going to help a lot of people, have a better idea, better grasp of what might be causing the problems. And let's not just treat these symptoms, but hey, let's get down to what's causing it.
Oh, absolutely. Yeah.
Well, a little bit of background about me. My wife and I have an assisted living home, and as part of an effort to learn more about senior issues myself, and also to provide a benefit to people in our local area, but nationwide, whoever want to pick up our broadcast, is that I am just exploring issues as it relates to seniors, right. And to date, anything and everything has been really educational for me. And I know that, at least from what I've heard, and I'll mention this when we finally go, but with your experience with senior patients, I think there's, I don't know, I think you can add a lot to that. And we can, your podcasts tend to be short. We can keep this, short. I like that you're concise, you're very clear. And so we don't need to go on, but I had some questions with regards to like real teeth versus dentures and partials, and caring for those. And then caring for those teeth, whether real or not, whether it's by the senior themselves or as they transition into, whether they're getting in-home health or they are in a nursing home, assisted living, how does that change? And I'd just like you to talk about, when they cannot when seniors cannot take care of their assisted or their everyday living, they need assistance with that.
Absolutely.
It's something to consider that, hey, if you place mom or dad in a home, the caregivers are going to treat problems, fire alarms, right? They're not going to be, brushing and doing disclosing tablets and making sure their oral health is, on par. So I'd ask some questions about that. I don't know if you know much about this, but I know that there are some mobile doctors. I know there's some dentists that kind of do like low income treatments at schools to some extent. I'll ask about that if that's a service. I haven't heard of it here, but I assume it is. And then, so just going over some of that, dry mouth medications, that's something I definitely would like you to hit on.
That's a biggie. That's a real biggie right there.
400 some medications that dry out that mouth.
Yeah.
And dry mouth. Well, I'll drink more, whatever. But I wouldn't think that it's gonna, make it more dangerous in my mouth for bacteria to grow and things.
I got a couple of stories that you'll enjoy on that one.
And I really hope that you do. I think that sharing a quick story about a patient or someone that without naming names, just helps drive that point home.
People remember stories.
Absolutely.
That's one way you can nail it home.
And then one thing I'd like to cover too, or I'd like for you to cover, when we talk about the dentures, the fact that they develop tartar and plaque, and they have the same problems that regular teeth do, and they need
absolutely. And one of the things, and I don't know if you want to talk about it or not, but you have to kind of choose your battles wisely when it comes to the elderly, because at what stage are they? Are we trying to keep them healthy? Is there health, or are there some other factors going on that maybe comfort is the better goal than health? Okay. So it all depends on where they are in their progression. We want to keep them healthy. We want to prevent other problems, but again, you got to choose your battles, because sometimes people get a little cantankerous.
Yeah, no, I know. We've experienced that. Sometimes they don't want, they don't want to brush their teeth, and that's another thing I wanted to ask about is, well, and I'll save that question for later. And then once we've gone through that, basically, I know that she asked you a little quote or word of wisdom at the end. If you've got one, I love to pick people's brains. And if it's going to put you on the spot, we'll cut that out.
I appreciate the warning anyway. Let's see if we can come up with something. Yeah.
She says you never fail, so I don't know if she gives you that warning.
No,
I'll always ask a non topic related. Just people have a lot of wisdom, and so to the extent that I could gain any of that out that maybe are off topic, but something that people like to share with others, I'd like to do that too.
Well, I like the one statement that says, if you think you can or you think you can't, you're right.
That's good. No, it's a great one. Let's end with that. Okay.
I can't brush my teeth. I can't take care of them. Well, if that's the attitude you want to have, you're absolutely right. If I can be healthy, I can take care of myself. I am not, I can do this. Hey.
Okay. Is it, can you say your last name? I don't want to butcher it.
Reinhartsen.
Okay, Reinhartsen. That's not too bad. Reinhartsen.
Great-great-grandfather was a Reinhardt, and he had a son.
It was a Scandinavian? Is that where?
Yeah, sure. You betcha.
Yeah. Okay, Reinhartsen. Excellent. Okay.
You can always tell a Norwegian. You just can't tell them much.
I like to see you've got these. They just come off the tongue. That's
yeah.
Cool. Okay, and your Filthy Mouth is your podcast, right?
Yes, yourfilthymouth.com. Yep. And then I have one for physicians, yfmdoctors.com.
Okay. And that's for like medical doctors and other physicians?
Absolutely.
Okay.
And there's a page that they can actually download where they can request a dental report from their patient's dentist. And this gives them some good questions to ask.
And is it, in order to share that, is that, well, we'll get into it. I mean, I feel free to bring all this up. This is
sure.
Good. I just wanted to do like a cut, and then we'll just do a quick intro. But is that something that all you need is like just one more like form to sign that I'd like
absolutely
you to disclose to my PCP or whoever it is?
Release of records, no problem.
Okay,
we do it all the time.
Okay. Okay, and you're are you in like the Orlando area? Is that like are you in a suburb or?
Well, yeah, kind of we're about 20 miles north of Orlando.
Okay.
So
that's kind of like where we are to Phoenix. We're just east.
Close enough and far enough.
Yeah. I don't know if Orlando's grown as much as Phoenix has, but it's crazy.
Yeah. Yep.
Okay.
The mouse.
The way is that? Yeah. Okay. All right. You ready?
Yep.
Okay, I'd like to welcome on Dr. Charles Reinhartsen, who has been a practicing dentist since 1979. He brings a wealth of experience. He is the co-host of Your Filthy Mouth podcast at yourfilthymouth.com, and then yfmdoctors.com is a podcast directed for physicians to share information between dentists and doctors and other medical practicing groups. He has been practicing in the Orlando area for the past 40 years now.
Yeah, it's going fast. Yep.
Yeah. Well, if it was 79, it'll be this year. You're going to hit that mark.
Yep.
Before we jump into the topic at hand, after a long career, what prompted you to get into podcasting to share your message with other people?
Well, there's a lot of information that needs to be told, and my mission is, or passion is, there's a gap between physicians and dentists, and somehow we need to connect the two. The mouth is part of the body. The things that happen inside the mouth don't stay inside the mouth. I mean, what happens in Vegas may stay in Vegas, but what happens in your mouth goes through your whole body. And so trying to help people understand that it's not just a pretty smile and chewing and brushing your teeth, but there's a whole lot more to it. 50% of heart attacks are triggered by oral infections. That's a huge deal, and most people have no idea. So you start looking at strokes, looking at Alzheimer's, look at rheumatoid arthritis, look at diabetes. These are things where people have to be made aware that, hey, this thing right under your nose could be one of the big factors.
I like how you call the curtain of the mouth hides all the nastiness that goes on inside. And just to be clear, your podcast is called Your Filthy Mouth. It's not a NC-17 plus, right? It's not.
Oh, no.
It's literally the dirty mouth, the filthy mouth, right?
Literally, yeah. It's the curiosity approach. The first month we put the billboard up, we had over 800 hits.
Oh, no, it's perfect. It's perfect. One thing I'd like to start with is, as far as oral health and hygiene is concerned, is there any difference as far as caring for your teeth as you age, whether you have real teeth, partials, dentures? Obviously if you take them out or not, we'll talk about that, but specifically the cleaning, the brushing, the flossing, the soaking, if they're full dentures and they come out, it's all the same. Nothing really changes whether they're real teeth or fake teeth.
Well, yes and no.
Okay.
The mouth is a moving target. So yes, does it change from adolescence to adulthood? If you lose teeth, it's a moving target. But the whole idea is, no matter what age you are, you want to keep it clean. And the biggest challenge we have is plaque is the same color as teeth. So when you go in and you brush and you floss, how do you know you got it off? The average person spends 30 seconds or less brushing their teeth. That's not much, everybody said, oh, is that me? No. It takes between 5 to 7 minutes. If you've got dexterity, if you can get to the sink, it takes 5 to 7 minutes to properly clean your teeth. And if you can do it just one time a day right, it's way better than 2 or 3 times a day wrong. So our goal is to try and help people get this thing cleaned up. You don't have to have a Hollywood smile to have a healthy mouth, but you've got to have a healthy mouth to have a healthy heart. So
excellent.
Yeah.
When I come back from the dentist, from my regular cleaning, my teeth feel smooth, right? Mm-hmm. When they start feeling rough, is that plaque buildup? Is that what that is when it's not as smooth as it was?
Well, not necessarily. It could be who knows what. But the way you know is we're back to disclosing tablets. Those are the little pills. Since plaque is the same color as teeth, how do you know you got it off? When I was a kid in elementary school, they brought in those little pills that chewed up, and everybody's teeth turned all kinds of colors. And man, we're pulling it out today. We're using it on everybody, starting with me. And because I want to make sure my mouth is healthy, and our whole staff, every patient, we're doing it. And it's amazing where people, you think you've done a good job. You put your tongue over, it feels clean. It's doing okay. Well, that doesn't really mean a whole lot. So you've got to grade yourself. If you take a test and nobody ever grades it, how do you know how good you did?
It's true.
So this way you can grade it, and nobody's going to yell at you, but you can yell at yourself.
Well, and hopefully people are getting their semi-annual checkups, but it's kind of like if you're
Yeah.
in class, if you're going to use the test reference, there's no quizzes, there's no weekly homeworks, there's no checking except for like twice a
No.
year at that checkup. So if you're not using disclosing tablets, if you're not brushing effectively, you won't know, but hopefully you're going twice a year. People obviously wait a lot longer than that, but there's no spot checks. So I think your solution of disclosing tablets is a really good way to find out where you're at in between.
Yeah, just once a month, once every couple of months, whatever it takes until you realize, oh man, that's the place I keep missing. Let me get it better now. So,
and how long does it take if you're not like checking up on yourself and making sure you're doing an adequate job of cleaning your mouth? How long does it take for a problem to go from bad to worse? And I know you'd mentioned before that it's not necessarily the pain, but something that's more serious.
Well, from not feeling anything to feeling something could be from, and I'm not saying from not when it's starting. So it can start,
Right.
You don't feel anything going on for maybe 3 or 4 months, and then all of a sudden you start having a little toothache, or maybe the tooth is sensitive to temperature. But that's the only time it's temperature. And if you keep the cold off of it, it doesn't hurt. So you tend to keep the stuff away from it. But the cavity is still growing and growing. As it gets into the nerve, pretty soon you get the cold on it. Now it's hurting for 2 or 3 minutes, and the next thing you know, it's spontaneously hurting. We've taken a situation that could have been taken care of with just, number one, prevention, but number two, a small filling, but now it's gotten bigger. Now I need a root canal. So, action is delay is expensive. And one of the things I try and help people understand is dental care is not expensive. It's really not. Now, dental neglect is very expensive. I'm going to tell you that.
Mm-hmm.
But dental care, you could do at home for free. And if you just go in, just like changing the oil in your car, it's a whole lot better to change the oil in your car than it is to wait for the engine to quit and then have to get a new engine. So,
well, and I know I've heard you say before that pain is a good motivating factor when it comes to oral hygiene.
Yeah.
But often, as you mentioned, we don't feel that pain until we're in serious, dire straits. We're not feeling that pain when it starts.
Well, about 90% of dental infections have zero pain, absolutely no pain. So gum disease, there's no pain with gum disease. And according to the Center for Disease Control, over 70% of the population in the United States over the age of 65 has periodontal disease, which is not just an inflammation of the gums, but now you're beginning to destroy the bone under the gums, which again is dumping all kinds of bad products into the bloodstream, which is going to the heart, going to the brain, going to the pancreas. So there's a lot of bad things that can happen in a hurry.
And when you talked about 5 to 7 minutes to make sure you do an adequate job of cleaning your mouth, I noticed that some of the electric toothbrushes have a 2-minute cycle.
Right. So
is that insufficient, or are you adding flossing or water irrigation, the water picks on top of what's a good breakdown of that 5 to 7 minutes?
Well, first, let's look at what is the goal of brushing your teeth. It's to get the bacteria off your teeth without damaging the tooth or the gums. Now, where does the bacteria get on the teeth? Only where a toothbrush can reach? No, it gets in between the teeth. So how do you get in between the teeth? You've got several options for that. You can have dental floss, which again, very few people floss properly, okay? Most people, I call it popping. Or daily, yeah. Absolutely. Well, you got a hunk of meat caught in there, you're going to take it out.
Yeah. Or corn. I hate corn for that very reason.
Oh, yeah, broccoli, all that stuff. So, so to properly floss, you put the floss in between the teeth. You have to wrap the floss 180 degrees around one of those two teeth, slide the floss up and down several times, wrap it around the other tooth that you've just gone in between those two, slide it up and down several times, pop the floss out, and then go to the next space.
Wait, you said 180 degrees. So if you're putting floss in between your teeth, you basically have to make a U-turn and go backwards against the tooth you're...
Bingo.
And doing both sides. So you go
Bingo.
one way. Okay.
Absolutely.
When I do it wrong.
Yeah. Most people pop. They take the floss in between the teeth, wiggle around a little bit, take it out, and go to the next one. That's popping. That doesn't rub the tooth. That doesn't get the bacteria off the teeth. What I tell little kids, and which is great, because when I'm telling senior adults, they get it too. Everybody has little bugs on their teeth. We call them sugar bugs. Mm-hmm. And the reason we brush our teeth is to get the sugar bugs off of our teeth. Because if we don't, when we're sleeping, those sugar bugs go poop all over your teeth. And that poop is so bad, it makes holes in your teeth, it makes your gums bleed, and the little kids get it, and so do the adults. They say, oh, yeah, now I understand. So we've got to get the sugar bugs off. We've got to get the bacteria off. And that includes not just where the toothbrush can get, but also in between the teeth. Another thing Now, I rarely floss. I'm going to tell you that from the beginning. I 4 or 5 times a year, but I use directed water irrigation every day. And that's where you aim the water jet directly in between the teeth with as warm of water as you can comfortably tolerate. Put it on high and just let it sit there for 5 full seconds. 1 Mississippi, 2
Between
Mississippi,
each teeth?
between each spice.
Okay.
Okay, but don't go on the outside. You don't want to shove water under the gum in the front, just in between the teeth.
Okay.
So in between, all the way around, just from the outside in. That Waterpik actually did studies that showed that if you brush and floss your teeth and spit out, you're only getting out about 25% of the bacteria that you just loosened up. When you're using directed water irrigation like this, you're getting out close to 90%. So you don't want to just rearrange the furniture in the house. You want to get the bacteria out of the house. You want to get the furniture out of the house. And that's why, so again, the cleaner we can keep this little contraption right under our nose, the better it's going to be for our whole body.
And just the water alone, you don't have to add anything to it. Just rinsing that water is enough to get the bacteria out between the teeth?
As warm of water as you can comfortably tolerate. Don't burn yourself. Don't burn it. But warm water, that opens things up and really helps to get it right through. And now when you open your mouth, because they make ones, your Waterpik you use by the sink, and they make one that you use in the shower called the shower breeze. And pop it up in the shower. And so you can use it in there and you don't have to worry about making a mess in the sink. So
I like that.
And they're inexpensive. You can get it on Amazon.
I'm going to look for that. Okay.
Yeah.
With regard to older teeth in the senior mouth, is there any difference are older teeth more brittle? Is there any difference between a 90-year-old's mouth and say a 30, 40-year-old mouth?
Quite a bit of difference. One thing that happens is a lot of times you're going to have some recession over the years where the gum has gone down a little bit and you have a lot more root exposed. Well, the root surface is 7 times softer than the enamel. So on a lot of senior adults, you're going to find cavities on the root surface because that's a softer area. And a lot of times people will not brush as well. My uncle took some medication that gave him a dry mouth. And I have been doing his dental care for a long time. And so he came in this one time and he had 6 cavities. I go, wait a minute, what's going on here? He said, well, nothing. I said, what are you doing different? He says, nothing. I said, are you taking different medication? Oh yeah, they put me on this medication for my blood pressure. So it's dried out his mouth. So he put a dish of lemon drops by the side of the bed. So at night when he go to bed, if his mouth would get dry, he'd pop a lemon drop in. Moisten his mouth, and he felt that was fine. Well, he's feeding the bacteria in there with sugar like crazy. Yeah, all night long. Yeah. And 6 cavities within 6 months. So he as soon as he saw that, he stopped doing that, and he just sips on water at night now. But yeah, it's so much easier to get cavities when you have a dry mouth, and a lot of seniors have that.
Is that a natural progression, the recession of the gums, or is it something that happens, due to poor oral health? I mean, do a large percentage of people, say in their 90s, have that recession of the gums on the teeth?
Many of them have it, but it's not a natural process as much as it is a reaction to improper brushing for many, many years. There's a good way to brush your teeth, and then you can be over vigorous and do damage with that. So yes, you can brush the gums so hard that they actually go down away from the teeth a little bit. So you got to be careful, what to do on that. I had a patient came in the first time I saw him as a patient. His whole chin was swollen up. The only teeth he had left was his lower front 6 teeth, and he was not going to lose those lower front 6 teeth, by God, no matter what happened. Every night he scrubbed those teeth so hard, he just scrubbed them. And he actually wore notches into the nerves of 4 of those 6 teeth, had abscesses down there, ended up losing 4 of the 6 teeth, not because of a bad attitude, a wonderful attitude, but a bad technique.
Yeah.
So you got to be a little bit careful with what you're doing. I mean, 2 aspirin are good, but don't take the whole bottle.
Yeah, absolutely.
Yeah.
Well, I know I think my wife was a teenager at the time when she had a poor technique and she had to get a graft on something that she had just exposed that down there near the root.
Yep.
Okay. And what about for someone who's able to care for their teeth properly? Now, educate me on this. I know that from my exposure to full dentures, they come out. There's an adhesive to apply them to the gums during the day, and generally they're soaked in a antibacterial solution at night. Or how does that work?
Well, if the teeth are fitting really well, you probably don't need that adhesive that you're talking about. But what
Okay.
happens over time is our bodies change shape. Have you noticed?
Yeah.
Yeah, well, so does the mouth. And
Okay.
over time, as the mouth changes shape, that hunk of plastic, that denture, doesn't really change shape. So sometimes you have to use a little stickum, a little adhesive to help hold that in place. Now, when you take that out, it's important to clean all the adhesive off of the denture or the partial, and also off of the tissues, because I've had people come in where that adhesive is over half an inch thick on the gum tissue, and the gum underneath it is just in miserable shape.
Hmm.
Okay, so yeah, you got to clean it, make sure that you're getting it cleaned off of the denture or the partial, and off of the in the mouth is as good as you possibly can. But yeah, you can build tartar calculus up on dentures and partials just like you can your natural teeth. Now, a simple way to get it off of that is soak your teeth in white vinegar for about a half an hour. That's a
Okay.
simple solution, okay? And you probably have that at the pantry anyway.
Yep.
So just soak it in white vinegar for not overnight, for about a half an hour. That'll loosen up the tartar, the calculus. It's like if you used what's I'm trying to think of that calcium remover for the
Oh,
bathtub and all that.
CLR.
Yeah,
Yeah.
any of that
Mhm.
stuff. You're trying to, but you want to be. It has to be safe that you can put it in your mouth. That's why
Okay.
white vinegar works so well. But you want to get all that off. Spend a little bit of time, clean that off. When I was way back 100 years ago, when I was in dental school, we went into a nursing home to help the people that had not had we just cleaned dentures. So what we did, and some of these people had not had their teeth out of their mouth for months.
Oh, wow.
They stunk. The people were, as soon as we got these things cleaned up, the people had tears in their eyes. They were so happy. They felt human again. So you put yourself in that person's shoes if you can. So if you got some really filthy teeth in your mouth and you got to put up with it, that's not always nice.
No, and you bring up a good point, because a lot of times people, when they need help, when they're in an assisted living home or a nursing home, they're not going to complain about some things. I mean, maybe it's not registering, maybe they have some form of dementia. Like, these things may not kick in to where
Right.
they're not going to complain about it, but they may be in pain. They may be experiencing like side effects from that.
Yep.
Wow. Okay.
Yep.
And with regards to dentures and partials, are those designed to be removed at night and cleaned? They're not
I
like permanently affixed, correct?
That's correct. You have removable partial dentures or removable complete dentures, and they should both be taken out at night unless there's some breathing reason why the people have to keep them in. And sometimes with airway issues and different things, they may have to do that. But generally, you take them out. The gums were never designed to have a hunk of plastic or metal sitting on them 24 hours a day, so it needs a little bit of a break. So when you take the denture off of it, the gums are like, oh, thank you so much. Now, our bodies are going to change shape with time, but they're going to change shape a whole lot faster if you keep that in there 24 hours a day.
Yeah, that makes sense.
So what we want to do is slow down that progression so you can wear that denture comfortably for longer.
And I imagine if there is a lot of bacteria in the mouth where that plastic, the denture, is hitting the gums, there's going to be inflammation, and just, because it's rubbing into everything else, and bacteria in there is just going to make it,
And what can also happen is a lot of times the denture can have sore spots, but it's funny how you look at some of these sore spots and they're not sore, but they're open wounds.
Yeah. Wow.
And it's a pathway for bacteria to get right directly into the body there. So just because someone says it doesn't hurt, you still need to do an examination and see what's going on. Because if they've got sores or open wounds under their dentures and are not aware of it, and then you've got bacteria all over there, you can see it's the front door of the body.
Yeah.
Physicians are really good about having your back door checked, right? You need a colonoscopy.
Yeah.
But what about the front door? This is where everything's coming in.
Well, the problem is, if you've got a wound on the outside of your body, you can dress it, and if pus comes off, it's just going to go off. But if it's not absorbed into the bloodstream, it's going to go into your digestive tract, because it's in your mouth, right? It's not going
Absolutely.
anywhere. Everything is right there. If something, like you mentioned, anything that oozes out of a wound is going right into your body, one way or the other.
Yeah. They did a study they were looking for pneumonia on elderly men with periodontal disease, with gum disease. And this was on a study of men 85 years old or older with periodontal disease. And they found that if you had periodontal disease, you were 4 times more likely to die of pneumonia. Think
Wow.
about that. You're breathing in the bacteria that is all around your gums. So when you take those breaths, your water vapor, the bacteria are hitching a ride.
Mm-hmm.
And so when the doctors say, hey, you've got an infection in your joint, you've got an infection in your kidney, you've got an infection in your wherever it is, why don't you ask where the bacteria come from? They came from somewhere.
Yep. Well, given that it's pneumonia, it's coming through the mouth and into the lungs. Are there other links to oral hygiene as far as whether it's blood-borne or digestive-borne, where that bacteria is getting into those other tracts?
Well, absolutely, it's getting into the whole body. That's what I say. They've shown. I think I mentioned, maybe not, but where they took 40 blood clots and they analyzed this. These are people that had died from either strokes or heart attacks, and they took out those blood clots. They wanted to see
their death.
That caused their death.
Yep.
They wanted to find out what bacteria are in these. In all 40 of them, every one of them, was oral bacteria.
Wow.
Okay, so.
Wow. So they took it apart, and inside their little clot was bacteria that originated in their mouth.
Correct.
Wow.
Correct. This is a big deal. Are you understanding my passion?
That is a big deal. No, I get it. I get it.
Yeah.
Is there, and maybe there's an answer to this, but my wife's uncle came over once. Maybe we were out to dinner, and he had some bread before dinner, and he slathered on the butter, right, on his piece of bread. And I wondered, I asked him, did you get to that point where you just, don't care what you eat anymore? You're enjoying your life, you're enjoying your food, and you just, because I'm not perfect at it, obviously, but I wouldn't put like a 1/4 inch of butter on a piece of bread, because I'm trying to, watch my weight, my health, or whatever else. But is there a point beyond which it doesn't matter, or is good oral hygiene always going to affect us no matter what, all the way up until we die?
Well, oral hygiene is going to affect us up until we die. Okay, there's no doubt about that. The question is, at what point do we quit caring? At what point? Because you have to meet people where they want to be met. And one of the things they say down south, and I love the saying, is never try and teach a pig to sing. It wastes your time and annoys the pig. Okay, so you have to understand who you're talking to on some of these different things, and you can be right. But it's like the guy coming up to the intersection, and he had a green light. He could see the other car had a red light, but he had a green light, and he went right through it, and the other guy in the red light hit him in the side and killed him. He was right, but he was dead right.
Dead right.
He was dead right. So we got to be careful sometimes about, what's the goal? What does the person want? And if the person has gotten so far along in their health, sometimes all we're looking for is comfort for the mouth. Let's not have anything hurt in there. If the person still has some things that they want to do in life, if they want to get out, and here in Florida, we've got a lot of golf and fishing and all that. If you still want to get out and do some things, you got to take care of your body, which includes this thing right under your nose, includes the mouth. So, you kind of make a decision, but there are consequences to everything we do, either good or bad. So if you decide to delay on treatment, there's certain consequences that comes with that. If you decide to do things quicker, there are other consequences that come with that. Some consequences are good. Some consequences are other than good.
That's very political. It's very politically astute, right? It's good and other than like that. And to be fair, Florida is a kind of a retirement hotspot like Arizona. We don't have the beach, obviously, but we have a lot of people that come here, whether for full-time retirement or just this time of year when we have nice weather, we have snowbirds that come in to enjoy our weather. Yeah. And one thing I wanted to bring up is that what I've heard is that you have 250 patients that are 90 years or older that come to practice. So you are pretty experienced and have worked on many people who are in this age bracket. With regards to, I'd like to go into a little bit more as far as what the patient or the person wants. As someone who has a family member in a nursing home and assisted living, or even in home health, that they cannot function, they cannot take care of themselves the way they should because they have lost some physical mobility, a disease, or otherwise they're unable to perform that. How do you get someone to want to take care of their mouth? And I'll give you a story. Sometimes we have people who are in our assisted living facility that, they want to fight. on everything. They don't want to take their pills. They don't want to get ready for bed. They don't want to like do anything. And like, I like what you said about prioritizing and trying to, to work with them to the extent that they can. Like sometimes you might miss them brushing their teeth. And, also to some point as we age, we become more like children, right? Where we need help to do what's right. And how do you when you're 250 plus or whatever patients come in, how do you as a professional, a man with not only experience but a degree and the education and the continued education, how do you get someone of that age to impress upon them the continued need for good oral hygiene?
Are you looking for this wonderful statement that I'm supposed to have that tells how we get people to? Well, it's a great question. No, it's really good. It's because it's so challenging. It depends where they are mentally. It depends what they want. People will do whatever they want, and so sometimes you just have to make them want certain things. So if you can show them maybe what a nice smile would look like on them with just cleaning up their dentures or something, maybe they would want that, and they want those keep a little nicer. But one thing that families, and I really encourage this, is that as often as you possibly can, go in and check on your loved one, because you're right. People that are watching them, they've got 17 other things to do, and they're not going to probably go in there and do a good job cleaning their teeth or spending a little bit of time with them. So if a family member can do that, that's wonderful. Electric toothbrushes make it so much easier. They've got these little basins you can put right under where they can sit in the bed if they need to, and you brush their teeth right there. Mm-hmm. But the more you can make your mouth feel clean, the better it is. But I don't have a magic wand. I wish I did, to make people want to do some of these things. So.
Well, no, and it's good. I mean, there is no magic potion. I think to the extent that someone in their 90s is able to have that conversation and have reason and logic and still have their mental faculties about them, I think trying to help them see the immediate benefits of oral hygiene, maybe not so much, hey, in 10 years you may have something, because they're not worried about that, but the immediate effect of, hey, my teeth feel better, my breath is fresher, like I feel better because my teeth, my dentures, whatever it is clean. And so there's immediate payoff versus, brush your teeth now, kids, or you're going to have a cavity in 10 years.
Right. Well, there's, like you say, everything has consequences. So, but the getting back to encouraging people and going in and taking care of your own kids' teeth, it's nice to develop relationships with the staff that you have there too, to where if the staff in the nursing facility or wherever it is, if they know that you're watching and that you're there, sometimes they'll take a little better care of the person.
That's true.
And, and so you hate to use it, but sometimes it's your family. It's the ones you love,
Yeah. Next time you visit a loved one in a care facility or whatnot, it might not be a bad idea to put a disclosing tablet in their mouth and bring the caregiver over and say, hey, look at this. They're missing spots. Can you help them with this? You know what? That's a wonderful idea. Yeah. I mean, like you said, if they know that you're looking at it, they're going to be more careful about it.
Yeah.
Especially when you got this disclosing tablet and you see all the spots they're missing.
And you can have their family if you want. Look, check out the website, yourfilthymouth.com, because there's all kinds of literature for them right there too. And they can understand, oh, we're not just doing this so they'll have a better smile, or we're doing this to help maybe make that diabetes a little easier to control, or maybe that does have something to do with Alzheimer's, with dementia. They know it does. So if they can understand that it's way more than just fresh breath and a nice smile, then sometimes, again, that motivates us.
Yeah.
When you understand that, oh, now I get it. Now I'm connecting the dots. This is why it's so important. Yeah. Thank you.
Absolutely. Well, and you had mentioned at some point there was, I don't know if it was a study or whatnot, but that people who are able to keep their teeth healthy and clean and keep their teeth through their life, they have more longevity.
The American Dental Association did a great big statistical study back in the 90s, and they showed statistically how people that hang on to their teeth on the average live at least 10 years longer. And there's a lot of reasons for that when you look behind the scenes. Of course, there's the ability to chew your food, which is a good thing. But what about all the infections that were involved in losing the teeth? What about all the damage to the body during those 20, 30 years that you went through losing those teeth? And so that played a big role on the body.
Oh yeah. Well, if you're doing 5-7 minutes a day times however many days, that's a pretty good payoff for 10 years.
Oh my gosh, think about it. And it's not only the dental expense that you're preventing,
Mm-hmm.
but it's also the medical expense and the medical damage to your family. I mean, that's no fun.
Yeah, like I said, with all the infections and everything else that led to losing your teeth, what side effects, what pneumonia, what other systemic problems became of that because of those infections in the mouth.
But the mouth never hurt, so we never did anything about it. The number one reason for not seeing a dentist: no pain.
No pain. Can you speak about medications? I know that a lot of people, as we age, we get more because we have more symptoms. We have more pain. We have more problems with our body, and so it generally, as we for each decade, we pick up a new prescription or two, and by the time we get to 80, 90 years old, we have quite a bit of them. How does that affect our oral health?
Well, we've already talked about some of them, how much they dry out your mouth, and that's one thing that they'll like. There's over 400 medications. High blood pressure medication that's what a real biggie on that. But a bunch of things will. If you take, this is what I've read anyway, if you take one medication, just one, there's a 50-50 chance you're going to have some type of an adverse side effect on your body. It could be a dry mouth, it could be blotchy skin, it could be something so just minor. If you take two medications, there's a 90% chance that between those two medications and your body, you're going to have some type of an adverse reaction. I mean, it could be ringing in the ears. It could be, who knows, it could be something. If you take three or more, it's guaranteed. And what happens so many times when you got this third medication in there and the fourth one, now they're giving medications to treat the symptoms that are created by the first, pills that you were taking for so it's like, where does this end? So I'm not saying get rid of all medications, but I am saying we need to be very careful about what we're taking, why we're taking, and then we have to be consistent with how we take it. But I think we're over medicated. And I think if we were to remove so many of the bacteria from the mouth, let's get to the source, not just the symptom. And so many of the source, unless you have an open wound on your body, you got cuts somewhere on your body, this is the front door. Mm-hmm. And so it's if we can clean that up, it's amazing. There's some medications we just might not need. So
with regard to dry mouth, so the saliva acts as an agent to help protect the teeth. How does that function work?
It dilutes the bacteria, dilutes the acids that are produced by the bacteria, by the plaque on your teeth.
Okay.
So if you've got concentrated acid going up against the tooth or the gums, it's going to do more damage than if it's diluted with saliva. So what I have people do is I've got one guy, he actually made a holster for his water bottle. And so everywhere he walks around, he's got his holster so he can moisten his mouth, because it's a big problem. Yeah. And if you have complete dentures or partial dentures and you have a dry mouth, now you don't have the saliva there to help you form the suction. Plus, you get way more sore spots because there's more friction between the plastic and the tissues.
So drinking more often, does that help combat the reduced amount of saliva from medications?
Yes, it does. Okay. And they do make like biotin and some of these other things that help a little bit. I haven't found one yet that's the one that's going to really make everything as comfortable as natural saliva. Okay. But sipping on water is about the best thing you can do.
Okay. One other thing I wanted to touch on, perhaps the last thing, was a story that you had related in a previous episode of yours about a patient who had I think it was a father maybe, who was going into a care home up north and had some work done, but it wasn't as extensive. And then after some time at the care home, needed a lot more work done. And because they were unable to travel, other physical health conditions, it became a lot more difficult.
That's exactly right. So yeah, this was a friend of mine. His dad, my friend was a dentist, and so he wanted to get his dad. He was going to be moving back up north. He wanted to get his dad good and healthy to where there wouldn't be any dental problems. And so some of the teeth he put crowns on, but some of the teeth had some big fillings, but they were in great shape. They were doing fine. So man, you don't want to take out this really good filling and just put a crown on there. So he didn't. And he kicks himself because he should have, because the crown was so much stronger than what the filling was. And after being up in there for a few years, then these fillings are breaking. And now what? Now transportation becomes more challenging, and medications are more of a deal. So the best thing for any one of us is to get our mouths as healthy as we can, and then just maintain it. You know, it's even if it may take you 4 or 5 years before you have your mouth properly restored, because I don't know what everybody's situation is, but if you can just nip, you know, how to eat an elephant, you know, one bite at a time. Mm-hmm. So if you can finally get it taken care of to where everything is healthy and you're maintaining it, your dental expenses in the future should be very, very, you know, minimal, not to mention the other medical things that you could be preventing.
You seem to be good with quotes. What's the one about an ounce of prevention or something?
The ounce of prevention is better than a pound of cure.
There you go. Okay.
Yeah.
That's the truth in this case as well.
Well, I like the one, so we give a man a fish he eats for a day, teach him how to fish, and he eats for the rest of his life. And this is what we're trying to do. We're not teaching people how to fish, but we're trying to teach people how to take care of their teeth, how to take care of their mouth. And they're going to live more than just another day, you know, just keep on going.
Absolutely. Well, Dr. Chuck, thank you for your time today. I love your passion for this issue. And as I mentioned when we first got on the phone before we started recording, this is something that I think we all could use a good reminder of. I did. As I mentioned before, I ordered my disclosing tablets. We're gonna go through that. I'm gonna have all my kids brush their teeth, and we're gonna see who does the best.
Beautiful.
You know, and just thinking about it too, one thing that we do in our family a lot for our rewards is a treat, a sweet ice cream or something like that. I'm thinking if we're going to do disclosing tablets, we probably need a different reward than candy, you know? So it just makes me think about it. And I know that thankfully we've haven't had too many major issues with our mouth, but it's always a good reminder to make sure we're doing our best and spending the time to take care of our mouths.
Yeah, well, that's super. That's super.
Well, we mentioned both of your podcasts. You also have your filthymouth.com where they can get the podcast and also the articles and other links that you have. You have a lot of good information there, links to studies that you had mentioned here and others that it's a great resource for people who are looking to learn more about how oral hygiene affects not only our mouth, but our overall health. Is there anything, and I know that if anyone listening is in the Orlando area, I would recommend Dr. Chuck. Not only is he a great guy and fun to talk to, but he has a lot of information that is very pertinent at this time. And if I ever move to your area, you are going to be doing my dental work. So I appreciate your time today. Is there anything else that you want to cover before we sign off?
No, just have people understand that so many times the answer to so many of our problems is right under our nose. And I've said that a couple of times, but it really is. And if we can just focus on that a little bit and realize this is the front door to our body, oh man, life will be so much nicer for everybody. So, because when somebody has an issue, it doesn't affect that person, it's the whole family. So we want the family to be happy.
Excellent. Okay. All right. Dr. Chuck, again, thanks for your time.
Thank you so much. It's been a pleasure.